Good morning, everyone. It's Dr. Esioso Guidaro, physician, scientist, neurologist, neuroscientist, and health disparities researcher. Today, before I head to work, I just wanted to give you medical trainees some advice on how to succeed in the wards, especially for those who are getting ready to be first-year doctors as interns. Just want to talk to you about things that do not necessarily get taught. You figure it out along the way, but because you're listening to my videos, you don't have to figure it out because you'll have the keys to do well day one of intern year and beyond. And this also will apply to medical students as well. So one thing in medicine is efficiency and having a system that you use every single time when you see patients. So for example, today we're going to be talking about briefly what system do I use when I see patients so that I don't miss anything and I have all the information that I need to be able to come up with a diagnosis, workup, and plan. So I'm going to share my screen and show you all the worksheet that I use. And over the years, you'll develop something that works for you, but know that when you start out early on, you want to make sure you have something that you use every single time to see patients. So we're going to be focusing on the new patient, or when you have to admit a patient to the service, or you're in the emergency room and you are instructed to go see a patient, or you have a patient that you have to go see. This is the sheet. I just print off this sheet every single time, or I practically have this memorized. So I just have several white sheets of paper in my pocket, and when I have to go see a patient, this is the format that I use. And we can make this bigger so that everybody can see it. You know, obviously, what's the room number, or what's their medical record number, or MRN is what we typically use in my institution. And then the big thing is what's the chief complaint. And then this is room for writing the HPI. I write a lot faster than I type, so I tend to print this off, go in with a pen, and just keep writing as they're discussing HPI. And then as I go and I'm getting the HPI, if they're telling me, oh, they have a history of hypertension, I'll put it right here. I'll get their meds and confirm allergies, social history, and surgical history. These are all key things that are important when you're getting the history. And some of this you can get on chart review. I don't like to go in blind when I see a patient. So before I go see a patient, I quickly look at their chart and pick out what's going to be key depending on the setting that I'm in. So if I'm in the emergency room, I'll write down key past medical history, key medications, key allergies, surgical history, and social history, for example. And sometimes you may not have that, and so you have to confirm it with the patient. Even if you do have it, it's always good to confirm it with the patient as well when you get into the room. So this is my format. And then I do my physical exam, and then neurology, I'll tell you guys about the systematic way to put in the exam for neurology. This is what I use. I'll just put a text box here. So I'm always doing mental status, cranial nerves, actually mental status, speech, cranial nerves, motor, deep tendon reflexes, coordination, sensory, gait. So this is how I do the exam every single time. So when I'm in the patient room, I have the system. I don't forget. And if I get paged, at least because I do everything very systematically, I can come back and pick up where I left off if I had to leave the room momentarily to take care of another issue. Just gonna move this text box. There we go. So that's how I approach the physical exam. And then when I'm done, I'll look to see what pertinent workup has been done, write the labs down, write the imaging down. Then here's where I formulate my assessment and plan. Like I summarize the patient's HPI, chief complaint, what do I think is going on? And then I kind of write my thoughts as to what I would want to order so that I don't forget. So that when I go to present, or when you go to present, you have everything right here on a nice piece of paper in order of how you would present. And it's very organized, and this will help you not to forget things when you move along in your career and things just get extremely busy and the responsibility increases. And a good thing about this piece of paper is that if you need more room, I just flip it over to the back side and just write more additional information. And then at the end of the day, I have, a series of sheets, and I just use this to write my note. So that's how I approach getting information from a new patient for admission purposes. And I really stress, as you are in your early career, figure out how you're going to be efficient. And this is one strategy that I've used, and it's really helped me stay efficient. Another thing that I do is once I have the sheet, so let's say the chief complaint is stroke. So what I do here before I go see the patient, there are certain things that I must ask when it comes to seeing a stroke patient. So I'll refer to my notes, and I'll just give myself little cheat sheets here. So for example, I need to know when's the last known normal. Do they have any stroke? What are their stroke-like symptoms? And I'll have another presentation that talks about, specific neurology emergencies and beyond. But I use this as my cheat sheet. So when I go in the room, I don't forget to ask these pertinent information. A big thing we always ask if a patient has a stroke is, do they have atrial fibrillation? And if so, are they on any anticoagulation? And if so, what's their last dose? So I'll remind myself here before I go into the room, once I know what the chief complaint is, then I'll fill out my, my little reminders all throughout this note here, so that when I'm doing the chart review or I'm talking to the patient, I know to, ask these questions. And for example, for the neurological exam, the biggest thing I'm going to want to do here is the NI stroke scale. So I just remind myself to do it here. And then it just makes it easier when I go see the patient. I don't forget what I need to ask them, and it just flows and you'll get into a system. So big takeaway from today is make sure you have a system when you go in to see patients. That's the foundations, the fundamentals. It's what's expected when you become interns, and you can start developing those skills when you're even in medical school, so that when you come into intern year, you have your system down and you can hit the ground running and you can thrive. With that, I got to go to work. And if you have any questions, you can find me on social media. You can look at my website and know that there'll be a lot more of these pearls to help you thrive in the wards. Happy studying.